Hi, this is Dr. Zeev Cohen, Medical Director at Principium Psychiatry. I am here to talk with you about ketamine therapy for depression. Now, ketamine is an anesthetic that's been around since the 1960s, and in the last decade and a half, we've discovered that it has great applications in psychiatry, and it's being researched for a variety of conditions, including depression, anxiety, PTSD. But we're really going to focus today on the effects of ketamine in treating depression. So, a patient who has had a history of depression and has not responded to medication typically will be asking what other options are out there for me. And there are treatments that fall under the definition of interventional psychiatry. So these are procedures that we use to transform your brain in a faster period of time than you would be able to achieve with medication. And one of the leading treatments in interventional psychiatry is ketamine. In fact, a recent randomized controlled clinical trial compared ketamine to electroconvulsive therapy. Now, this article was published in the New England Journal of Medicine, and which is the most prestigious medical journal in the United States. And the reason it was published there is that ketamine was actually found to be just as good as electroconvulsive therapy. Electroconvulsive therapy has been the gold standard in the treatment of treatment-resistant depression for many, many decades. So it's very exciting to find out that ketamine was actually equivalent to electroconvulsive therapy, especially because ketamine is much less invasive than ECT and has far fewer side effects. So how does ketamine actually work? Well, ketamine is thought to work through a variety of mechanisms. It increases neuroplasticity, it increases repair in the brain and neuronal cell growth. It increases connectivity between various regions of the brain. There's an increase in brain blood flow during ketamine therapy, and there's also upregulation of a very important neurotransmitter in mood regulation, and that neurotransmitter is called glutamate. So through all of these mechanisms, patients have an improvement in their mood, and often the improvement is quite rapid. So patients will describe relief after as little as just one infusion, although the recent literature suggests that as many as half of patients will require 4 or more infusions to achieve substantial benefit for their depression. We usually do the infusions twice a week, and we generally recommend a course of 8 infusions. So that is about a 4-week treatment course. So that's really how ketamine works. We offer ketamine in all of our offices. Principium Psychiatry is multi-state. We have 2 offices in New York City, one in the financial district and one in Midtown near Grand Central Station. We also have an office in Southern Connecticut in Greenwich. And we recently opened an office in Santa Monica in the Los Angeles area of California. So we offer ketamine therapy in all of our locations. Patients will first have a comprehensive evaluation by one of our psychiatric providers. So you would see a psychiatrist or a nurse practitioner or a physician assistant, all of whom are specializing in psychiatry, and will do a thorough psychiatric assessment and give you a recommendation, not just with regard to ketamine, but your overall treatment plan. So whether ketamine is right for you, but also we are very interested in knowing whether we can improve your medication regimen. And we also offer a variety of psychotherapies. Psychotherapy has been shown to be very helpful in combination with biological treatments for depression. So there you go. I gave you a quick summary of how ketamine works, how we provide it at Principium Psychiatry. And if you would like to learn more, please visit our website, www.principiumpsychiatry.com. We have lots of information there about ketamine therapy and about depression treatment in general.